Lewis suffered from a number of chronic health problems, illnesses, and addictions related both to aging and a back injury sustained in a comedic pratfall. The fall has been stated as being either from a piano while performing at the Sands Hotel and Casino on the Las Vegas Strip on March 20, 1965, or during an appearance on The Andy Williams Show. In its aftermath, Lewis became addicted to the painkiller Percodan for 13 years. He said he had been off the drug since 1978. In April 2002, Lewis had a Medtronic Synergy neurostimulator implanted in his back, which helped reduce the discomfort. He was one of the company's leading spokesmen. Lewis suffered numerous heart problems throughout his life, he revealed in the 2011 documentary Method to the Madness of Jerry Lewis that he suffered his first heart attack at age 34 while filming Cinderella in 1960. In December 1982, he had another heart attack. Several months later, in February 1983, Lewis underwent emergency open-heart double bypass surgery. En route to San Diego from New York City on a cross-country commercial airline flight on June 11, 2006, Lewis suffered his third heart attack. He underwent a cardiac catheterization days after the heart attack, and 2 stents were inserted into one of his coronary arteries, which was 90% blocked. The surgery resulted in increased blood flow to his heart and allowed him to continue his rebound from earlier lung problems. Having the cardiac catheterization meant canceling several major events from his schedule, but Lewis fully recuperated in a matter of weeks. In 1999, Lewis's Australian tour was cut short when he had to be hospitalized in Darwin with viral meningitis. He was ill for more than 5 months. It was reported in the Australian press that he had failed to pay his medical bills. However, Lewis maintained that the payment confusion was the fault of his health insurer. The resulting negative publicity caused him to sue his insurer for $100 million. In addition to his decades-long heart problems, Lewis had prostate cancer, type 1 diabetes, and pulmonary fibrosis. Prednisone treatment in the late 1990s for pulmonary fibrosis resulted in considerable weight gain and a startling change in his appearance. In September 2001, Lewis was unable to perform at a planned London charity event at the London Palladium. He was the headlining act, and he was introduced but did not appear. He had suddenly become unwell, apparently with heart problems. He was subsequently taken to the hospital. Some months thereafter, Lewis began an months-long therapy that weaned him off prednisone and he lost much of the weight gained while on the drug. The treatment enabled him to return to work. On June 12, 2012, he was treated and released from the hospital after collapsing to hypoglycemia at a New York Friars Club event. This latest health issue forced him to cancel a show in Sydney. In an October 2016 interview with Inside Edition, Lewis acknowledged that he might not star in any more films, given his advanced age, while admitting through tears that he was afraid of dying, as it would leave his wife and daughter alone. In June 2017, Lewis was hospitalized at a Las Vegas hospital for a urinary tract infection. Lewis died at his home in Las Vegas, Nevada, on August 20, 2017, at the age of 91. The cause was end-stage cardiac disease and peripheral artery disease. In his will, Lewis left his estate to his second wife of 34 years, Sandy Pitnick, and their daughter, and intentionally excluded his sons from his first marriage as well as their descendants.